Right now, millions of older adults are taking medications that could be silently destroying their hearts. And here is the shocking part. These are not illegal substances or experimental treatments. These are common drugs sitting in medicine cabinets across the world. Drugs that doctors prescribe every single day. A growing number of cardiac surgeons and cardiologists are now sounding the alarm. They are seeing patterns in their operating rooms that they cannot ignore. Hearts that should be relatively healthy for a patient's age are showing damage that seems almost impossible. Inflammation markers are through the roof. Heart muscle is weakened, rhythm problems are appearing out of nowhere, and when they trace back the medical histories, they keep finding the same culprits over and over again. The research is finally catching up to what these surgeons have been witnessing firsthand. Major studies from institutions like Stanford, Johns Hopkins, and the Cleveland Clinic are now confirming what many suspected. Certain medications that millions of older adults take regularly are causing measurable, documented heart damage. We are not talking about rare side effects that happen to 1 in a million people. We are talking about significant cardiovascular risks that affect substantial percentages of users. Some of these drugs increase heart attack risk by over 40%. Others double or even triple the chances of developing dangerous heart rhythms. And the most alarming part is that many patients have no idea they are at risk. But there is one drug on this list that stands above all the others. One medication that cardiac surgeons are now calling the silent heart killer. The research on this particular drug is so alarming that some experts believe it should carry a black box warning specifically for older adults. A massive study involving over 500,000 patients found that this drug was associated with catastrophic cardiac outcomes. And the worst part is that alternatives exist that are far safer. But before we reveal that #1 drug, let me walk you through the complete list so you understand the full picture of what could be damaging your heart right now. Before we begin, let us know in the comments your age and where you are watching us from. At PrimeYears Lab, we read and reply to every single comment. Now let's start with the medications you must investigate before they compromise your vitality. Number 7. Proton pump inhibitors. You probably know these drugs by brand names like Prilosec, Nexium, and Prevacid. Commonly called PPIs, they are among the most prescribed medications on the planet. They work by reducing stomach acid, which helps with reflux and ulcers. For short-term use, they can be life-changing. The problem is that millions of seniors have been taking them for years, and the cardiac consequences are now impossible to ignore. A landmark study published in the journal PLOS One examined data from nearly 3 million patients and found that PPI users had a 16 to 21% increased risk of heart attack compared to non-users. The mechanism is terrifying. PPIs appear to reduce the production of nitric oxide in the cells lining your blood vessels. Nitric oxide is critical for keeping your arteries flexible. Without it, your arteries become stiff, blood pressure rises, and the risk of dangerous clots increases dramatically. Another study from Stanford University found that PPIs were associated with a doubled risk of cardiovascular mortality in patients with existing heart disease. If you are over 60, it is time to discuss H2 blockers or lifestyle modifications with your physician. Number 6. Fluoroquinolone antibiotics. This one catches most people completely off guard. Antibiotics save lives, but the class known as fluoroquinolones, including Cipro and Levaquin, has been conclusively linked to serious heart structural failures. A major study in the Journal of the American College of Cardiology analyzed 7 million patients and found that current use was associated with a 66% increased risk of an aortic aneurysm and dissection. This is when the main artery in your body develops a dangerous tear. In seniors, this is often fatal. Furthermore, these drugs can trigger QT prolongation, a change in the heart's electrical activity that can lead to sudden fatal arrhythmias. The FDA has issued multiple warnings recommending these only be used when no safer alternative exists. For a simple sinus or urinary tract infection, the cardiac risk may simply be too high for those over 65. Number 5. NSAIDs. Ibuprofen, naproxen, and celecoxib are household names. While they are phenomenal at reducing arthritis pain, for seniors, the cardiac price tag is devastating. A comprehensive meta-analysis in The Lancet examined data from over 350,000 patients. The findings were striking. High-dose NSAID use increased the risk of major cardiovascular events by 1/3. Ibuprofen increased the risk by 44%. These drugs block enzymes that protect the heart and blood vessels, shifting the balance toward clotting and higher blood pressure. They also cause the body to retain sodium, putting immense strain on a 70-year-old heart. Even short-term use has been shown to increase risk within the first week. Alternatives like acetaminophen or topical gels often provide relief without the systemic cardiac threat. Number 4. Sulfonylureas for diabetes. Diabetes itself damages the heart, which makes the choice of medication critical. While newer drugs like GLP-1 agonists actually protect the heart, older drugs like glyburide and glimepiride, the sulfonylureas, have been linked to increased cardiac risk. A study in Circulation, Cardiovascular Quality and Outcomes followed 250,000 patients and found that sulfonylurea use was associated with a 20% increased risk of cardiovascular death compared to metformin. These drugs can cause low blood sugar crashes, which trigger stress hormones that are incredibly hard on the aging heart. They may even accelerate the progression of plaque buildup in the arteries. If you are still on these older medications, it is a vital conversation to have with your endocrinologist. Number 3. Z-drug sleep medications. Sleep is the foundation of health, but reaching for Ambien, Lunesta, or Sonata may be a deal with the devil. A large study in BMJ Open found that hypnotic sleep aids were associated with a 4.5 times greater risk of death compared to those who did not take them. Cardiovascular events were the leading cause. These drugs can suppress respiratory drive, worsening sleep apnea, a major risk factor for heart failure and stroke. Furthermore, the grogginess they cause leads to falls, and the physiological stress of a hip fracture can trigger a terminal cardiac event in a senior. Cognitive behavioral therapy for insomnia, CBTI, is now considered the gold standard, offering better sleep without the mortality risk. Number 2. Antipsychotic medications. Often prescribed for agitation or behavioral issues associated with dementia, the use of these drugs in seniors has grown substantially. However, the cardiac consequences are so severe that the FDA has issued black box warnings. A study in the New England Journal of Medicine examined 44,000 elderly patients and found that those taking antipsychotics had double the risk of sudden cardiac death. These medications can disrupt the heart's electrical rhythm and cause sudden drops in blood pressure when standing up, known as orthostatic hypotension. This leads to fainting and cardiac arrest. In many cases, behavioral issues can be managed by identifying underlying pain or environmental triggers, avoiding the need for these high-risk prescriptions. Number 1. Long-acting opioids. We have arrived at the medication that cardiac surgeons say poses the single greatest pharmaceutical threat to the aging heart. We are talking about oxycodone, hydrocodone, and morphine. While they are effective for severe pain, their impact on the cardiovascular system is undeniable and often catastrophic. A massive study published in the Journal of the American Heart Association analyzed over 575,000 patients over 65. The researchers found that long-term opioid use was associated with a staggering 65% increased risk of cardiovascular death. Opioids cause significant respiratory depression, lowering oxygen levels in the blood and stressing the heart muscle every single second you are asleep. This chronic oxygen deprivation triggers systemic inflammation and oxidative stress, damaging blood vessel walls and leading to changes that resemble heart failure. Furthermore, opioids disrupt the autonomic nervous system, making the heart less able to respond to stress and increasing the risk of sudden cardiac death. The cardiac surgeons sounding this alarm are not suggesting you stop your medications today without a plan. What they are urging is an informed, brave conversation with your healthcare provider. Many prescriptions that seemed safe 10 years ago are now known to carry significant risks for those over 60. The research has evolved, and your treatment plan must evolve with it. The damage from these medications is often preventable, but only if you are aware of the risks. At PrimeYears Lab, we believe your heart deserves the best protection possible. Are you planning to have this conversation with your doctor, or do you feel that bringing up these concerns might be difficult? We want to hear your thoughts. Share your experiences in the comments below. If you found this evidence-based report helpful, share it with someone you love, because after 60, your heart is the engine of your independence. Thank you for watching.